needed prior to placing NG tube. Nasogastric tube, typically size 5 to 8. Water-soluble lubrication. Tape. Clear dressing. Protective dressing. Syringe. Stethoscope. Towel. Gloves. Support person or blanket for swaddling. Wash hands for at least 30 seconds. Gather and prepare equipment. Cut tape. Four pieces of tape will be needed. One for placement marking, one for temporary securement, two for permanent securement. Open packaging of clear and protective dressing. Put on gloves. Determine the length of the NG tube to insert. Use the NG tube to measure from the tip of the child's nose to the earlobe and from the earlobe to the area between the belly button and the middle of the breastbone. Place a small piece of tape at that site as a reference point. Place a towel under the child's head to protect the linens below. Take syringe and pull back 2 to 3 mL of air. This will be used to check placement. Attach the syringe to the end of the NG tube and place to the side. This would be an appropriate time to swaddle patient if you are inserting the NG tube alone. Dip the tip of the NG tube in lubrication. Gently insert the NG tube into the nostril, aiming down and back to follow the body's natural path to the stomach. The child may gag. Continue insertion until the measured reference point of the tube reaches the opening of the child's nostril. Temporarily secure the tube to avoid accidental dislodgement until placement is verified. Unwrap child to check placement. Check for placement by pushing 2 to 3 mL of air rapidly from syringe into NG tube while listening with a stethoscope for a bubbling noise in the stomach. Next, pull back 2 to 3 mL on the syringe to remove the air. Don't be alarmed if liquid comes back. This is another way to check if the tube is in the right place. If any liquid comes out, push it back into the stomach. It could contain medicines that your child needs. When proper placement is confirmed, re-swaddle baby. Anchor the tube to the child's face using the protective dressing, tape, and clear dressing. Remove gloves and wash hands. Special considerations. The indwelling NG tube needs to be changed every 30 days. If the tube needs to be changed, change it before the feeding instead of right after. There is a higher chance of the child choking on the feed if it is done after the feed. When inserting NG tube, child may have slight color change, may gag, cough, or hold breath, and may even vomit. Do not panic. This is a natural reaction. Sometimes when inserting an NG tube, resistance can be met. Give the child a few seconds to take a breath and/or calm down, and gently continue to insert the tube. Sometimes blowing in the child's face will assist with this. If the child is crying or yelling during insertion, the tube may come out of the child's mouth. Do not be alarmed. Pull back the tube until it is no longer seen in the mouth. Wait until the child takes a breath and continue to insert the tube. If resistance, gagging, coughing, vomiting, breath holding, or color change continues for an extended period of time and the tube is still not placed, remove NG tube, give the child a break, and attempt the other nostril. Also, stand at the child's right side if you are right-handed or at their left side if you are left-handed to ease placement. If bubbling is not heard in the stomach after placement, attempt a second time by instilling air again using the syringe. If bubbling is still not heard in the stomach, remove NG tube, remeasure, and attempt again. Sometimes a small amount of blood may be seen on the NG tube or in the nostril from placement. If a second person is not present, infants and/or toddlers may need to be restrained by being wrapped in a blanket when possible to keep the child's hands away from the tube, which helps to prevent the child from pulling out the tube.